Good morning, everyone. My name is Dr. Khizra Syed. I lead digital health insurance systems for the Department of Health in Kisumu. I am a member of the 2023 East African Cohort for the WomenLift Health Leadership Journey. And today we'll take you through my leadership project, which is on impact of drone technology on adolescent sexual and reproductive health services in Kisumu. I'll begin by taking us through a project overview of what the drone technology involves. Kisumu County, a year ago, contracted a specialized drone service company to distribute commodities, blood, and vaccines to hard-to-reach areas via drone. So the drone is loaded with the vaccines or the commodities or the blood, and then it is flown to the facility where it is dropped via parachute, as you can see in the image on my screen. The aim of this project was to expand access to healthcare services. And for this particular project, we'll concentrate on sexual reproductive health services for adolescents and youth within the county. The idea is to have these commodities delivered during specific youth-oriented events. These events are organized every Saturday of the week, and they're held in different areas, whether it is community centers or healthcare facilities. So during those events, youth are able to access SRH services, for example, HIV testing, for example, FP commodities, and they can access this without having to go to the stigma of walking into a facility and being known for what services they're seeking. By overcoming the geographical challenges and the barriers that exist within Kisumu County, the drones are aimed to increase uptake of services and also to improve the uptake of specific commodities that are related to SRH. Why is this important to us? There's a critical need to address the confidentiality and the convenience of services for SRH commodities, specifically for adolescents and youth. Most of the time, a lot of healthcare services concentrate on either the very young, the infants, or the reproductive age. But this age in between, which is the adolescent and the youth, tend to get forgotten when it comes to a lot of healthcare services. With this in mind, improving these healthcare outcomes will empower the youth in the community and will enable them to access these SRH services. Currently, there's a high rate of teenage pregnancies across Kisumu County, and this could be attributed to the limited access to the SRH commodities and services within the county. Our collaborators for success are primarily three main ones. That is Zipline, the county government of Kisumu, and community-based organizations and healthcare providers. Zipline is the specialized drone technology organization that was contracted by Kisumu County, and their main responsibility is to ensure timely delivery of essential commodities, which, like I mentioned, includes vaccines, drugs, and blood. The role of the county government of Kisumu is to ensure that clinical operations run smoothly. It is their responsibility to procure the commodities and to make them available to Zipline for distribution. The data remains for Kisumu County. The monitoring and evaluation responsibility also remains that of Kisumu County, and specifically the Department of Health. The community organizations and the healthcare providers are tasked with engagement with the youth during those events. They are required to mobilize youth to attend those events. They're required to create awareness. They're required to create a lot of noise that comes with those youth events for the sole purpose of making these events known to the public and to the community, and in such a way increase access for these commodities to these young people. This shows early results. This project has been running for about a year now, and we have so far reached over 26,000 adolescents, over 75 events in the year 2023 alone. The services provided were, for example, distribution of condoms, distribution of self-test kits, initiation of young people on either PrEP or PEP, of course, with the rightful counseling and the rightful assessment that goes into it, distribution of FP commodities, cervical cancer screening for the young girls, and also administration of the HPV vaccine. If you look at the numbers there, for example, condoms alone, we distributed 15,000 condoms that year. Our cervical cancer screening was at 266 for that year. This is ongoing and data is constantly being monitored with the aim to assess how effective this program is and what areas there might be for improvement. All programs come with challenges, but we know challenges pave way for solutions. The biggest challenge we've had is navigating the regulatory landscape, and this is specific to the Kenya Civil Aviation Authority. Kisumu has an international airport, and because of that, a lot of the areas are no-fly zones for the drones because of the security risk that comes with it. So a solution to this would be an integration of the hybrid model, where we propose to have areas that are not reachable by drone to be served by road transport. So either by motorbike or by bicycles or by the routine utility vehicles that the Department of Health has. Another challenge is the protection of the sensitive health information of the clients who are seeking services. And the solution to this is continuous capacity building and training programs to ensure that those healthcare providers who offer services are qualified, they're professional, they're well-trained, and then understand the importance of having their information kept personal and private. Another big challenge would be sustainability of this program. Currently, this is a public-private partnership between Zipline and the county government of Kisumu, but measures have been put in place to ensure that this program is sustainable on its own. Even after a period of maybe 2-3 years, the program can be sustainable on its own. And how we're trying to do this is to have it ingrained in the law so that irrespective of the political landscape and the changes that happen, the program is still very much in place. The plans for this program is to expand and cover the entire county with time, develop policy recommendations that guide the distribution of these commodities. We have seen a lot of instances where commodities are ordered not because they're needed, but simply because they're available via drone. So one of the policy recommendations that we need to develop is to put in place a mechanism that filters the orders that are made and the requests that are made and are served only on a need basis. There are continuous leadership opportunities through capacity building and stakeholder engagement with these young people and also with the staff on the ground, with the hope that they will grow and the project itself will grow. The 3 areas that have impacted me personally through the leadership journey have been the impactful leadership. This project or this journey has helped me keep in mind that my leadership styles and my leadership skills must be impactful. I must be doing things that make an impact, either to the community around me or specifically to young girls, where a lot of my interests lie, a lot of my soft spots lie. The other area is having authentic leadership, being able to speak your mind and being able to tell your story by just being yourself. You don't have to edit who you are, you don't have to change who you are, you don't have to redesign yourself simply because you're trying to fit into a certain shoebox. The idea is to have an authentic style of leadership where people will remember you for who you are and for the authenticity that the leadership program has provided. The other area that has really resonated with me throughout this leadership journey has been strategic leadership, where your style of leadership, your style of guidance has to have strategy. When you're handling a task, when you're handling a problem, it must be done with strategy and not just randomly or haphazardly. Because when you put in place strategy, it has taught me that you achieve better results. The leadership program has taught me that implementing these 4 areas of the leadership program have molded me and have taught me how to handle a lot of internal conflicts at my workplace, internal conflicts even in my personal life, and has helped me groom and carve myself in a way that my decision-making process, my thought process, my reaction time are well thought out. They're well discussed. They have an impact. They're strategic, and they're bound to set out some level of boundaries such that at the end of the day, whatever decisions have been made are decisions that have been made from a point of information. Thank you very much for your attention and for giving me the time to listen to my presentation. Thank you.